Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining us is Eric Collard. He's the Executive Vice President and Global Head of Experian DataLabs to tell us about the data models that government leaders are using to make those key decisions around COVID-19. Eric, it's great to have you back with us on Trade Talks, and just give us a high-level overview of Experian DataLabs.
Certainly. It's the R&D arm of Experian, which is a data and analytics company that employs about 17,000 people around the globe. We build products and services, mostly that are oriented around analytics, and we do that across all of the businesses that Experian operates around the globe. We've got 4 labs, one here in North America, one in London, one in Sao Paulo and Singapore, and they're predominantly data scientists and software engineers.
When you listen to our public officials talk that they're using data and models to help make critical decisions during this time, what are these models? How do they work in regards to these decisions being made?
Well, there's a couple of models that are being referenced pretty frequently. One is the SCIR model that's been around since the break of the measles. It came about 10 years after the Spanish flu epidemic, and it was designed to focus on the life cycle of the disease spread. So thinking about the process of it entering into a population, people are exposed, but they're not yet infected. They eventually get infected, and then they're removed from that infected population either because they've fully recovered or they've passed away. It assumes a short infection period. It assumes that people develop an immunity. So if they do recover, they're not re-entered into the susceptible population. It assumes a consistent transmission rate, meaning that it moves from people who are not infected to people who people who are infected to people who are not infected evenly, which we can get into later, which is a challenge because of things like social distancing and sheltering in place, which are policy changes that reoriented how the population, how the disease spreads through the population. But it's trying to answer some big questions. Really, the biggest one is what's the maximum number of people who will be infected at any given time? The other model is the IHME model, which is really new. So while the SEER model has been around for about 90 years, the IHME model has only been developed in the last 2 months. That came out of the University of Washington, and it was designed to really focus on the question that hospitals are asking, which is how many patients are going to be admitted due to this disease? How many beds do I need to have in place? How many ventilators do I need to have in place to be able to support the disease? So they're interested in a different question, which is what's the maximum number of people who will die or be seriously infected at any given time. So that model actually didn't focus on the entire life cycle of the disease. It looked at with laser focus on the very end of that life cycle. That has been in the press a lot because it's been very good at determining or forecasting the number of deaths that we might see in the US. And it includes a proxy for social distancing and sheltering in place by using mobile data to look at how mobility is changing over time. The most recent model is last week that's received a lot of press, and that's out of a team at MIT. And that's been focused on what we might see next, which is being referred to as the second wave. So both the IHME model and the SEER model focus on what we're experiencing right now. MIT tried to skate ahead and see what will happen when we lift these requirements of social distancing and sheltering in place and see what kind of spike we might experience in that resurgence.
How quickly can you amend with this new type of data, and what are some of the challenges with these models?
Well, all these models are driven by data. You know, they're trying to answer these basic questions for us without not a lot of history. You know, historically, they would pull in data from SARS or MERS. The data from Wuhan, China was very helpful in kickstarting both of these. But because of the data challenges, the results can be a bit sporadic. I'll give you an example. The most concrete piece of information that that's being collected to drive these models are deaths. You would think that's got to be super clear. If somebody dies from the disease, you'd be able to incorporate that in. But even the state of New York is reporting confirmed deaths. They're reporting probable deaths. And the New York Times recently introduced this idea of excessive mortality, meaning somebody may die because they couldn't go into the hospital because there were so many people being treated there. So this gives modelers a big challenge. What are they going to use to target when they're doing things like the IHME is doing, is looking at deaths and trying to figure out how many hospital beds are going to be required to support critically ill patients?
Can these models improve over time?
They can, for certain. And I'm really excited about what Experian is doing specifically in Brazil right now. So we've partnered with the United Nations, the World Health Organization, Amazon, Microsoft, and several universities in Brazil, where we're pulling together information, we're pulling the best modelers together that we can across the country. And the first phase is just focusing on trying to do the best job we can in tracking the disease in Brazil. Similar to the IHME model and similar to the SEIR model, we're trying to develop new techniques to do a better job of tracking that disease so we can inform the government, so we can inform banks, so we can inform hospitals, all the stakeholders in the process that need to put policies and programs in place to manage the disease. But I think the next tier of that is how do we evolve the modeling process itself? You know, when we're focused on leveraging an approach that's 90 years old, we'd like to think that we can improve that. And I think right now we're seeing a bump up in the amount of innovation that's taking place around figuring out how to do the best job of detecting and managing disease spread.
Yeah, and to wrap up here, when we look longer term and on the other side of COVID-19, this really has given Experian and the companies that you've been working with the Brazil project the opportunity to really innovate in preparation for the next crisis that people are going to be depending on your data to help us get through.
Absolutely. You know, it's two things. One is we're trying to help consumers and small businesses right now manage themselves through the crisis. We're providing free credit reports to consumers. They can access that every month on annualcreditreport.com. Small businesses can access their credit reports for free on our website. We're doing credit education on Facebook where consumers can ask questions to find out more about what the impacts are if they're going to miss a payment or what they need to do, what they need to talk with about their bank. So we're really focused on that. And in the future, we can see a lot of applications here. As we go into the realm of just beyond disease spread, but in the disaster prediction, catastrophic events, et cetera, there's a lot of opportunity here to improve upon how we've modeled and reacted to things in the past.
All right. It was great to have you with us on Trade Talks as always. Thanks so much for joining.
Oh, thank you very much.
All right. And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.